So before beginning today's session, I would like to tell something about ma'am, a brief intro, a short intro, I would say. So Dr. Shelly ma'am is MD and PhD, has been awarded her PhD degree from Defense Minister of India, Shri Rajnath Singh in 2023. She did DIP in ISCH Greece, have done advanced homeopathic course from Greece, and she's practicing since 2011. She's running 2 clinics independently in Maharashtra and has been publishing research articles in scientific research journals nationally and internationally. She was awarded Best Case Presentation in Liga 2019, invited national radio channels to educate people, ex-associate professor in physiology department, invited as key speaker to many colleges, conducted educated webinars, conducted many health awareness camps, and today her topic is layers of the mind, psychological mapping in a homeopathic case taking. I welcome you, ma'am, to the IFPH International webinar. Please start your session, ma'am. Thank you.
Yeah, hello, Dr. Manish.
Hello,
I
ma'am.
just spoke to Dr. Danish. Actually, my laptop have a breakdown, so I'm not able to use my slides, but I'll try to give my best through my lecture. So please stay with me, right?
Okay, ma'am.
Yeah, but just give me. So can you hear me properly?
Yes, ma'am. Yes, ma'am.
Okay, fine. So I'll be going to my slides. I'll be talking. Just be with me. I'll try to give my level best, right?
Yes, ma'am.
Give me 1 minute. So today I was about to talk about a topic which is about mind. What are the layers of mind? How to decode the layers of mind in any case, right? So whenever we have a case, the biggest challenge which we have in a case is just one, which is how to take the symptoms of the patient. We are excellent, we are excellent with MM. We are sometimes very good with the repertory. But the problem is, if you don't get the correct kind of symptoms, if you are not able to get the correct symptoms from a patient, how will you give the right remedy? Because homeopathy is not about you have a fever, then you give belladonna, or homeopathy is not about if you have a coma, you give what you call hellebores or opium. No, homeopathy is all about a totality. Correct? So the main thing in every case is about what symptoms you take from the patient. So this is what I'm going to talk. I'm going to talk a little bit about combining human psychology along with its application in homeopathy. So I hope everyone is with me. And am I audible, Dr. Manish?
Yes, ma'am.
Fine. So far, so good. Any doubts, please let me know, because I'm just talking and you're just listening to me, right? So see, whenever anything happens in our life, like for example, let's go to your childhood, right? So if you see in your childhood, there's a lot of traumatic events happening. Like for example, your father is hitting your mother. Give hypothetically, I'm talking about. He's very aggressive. He's very alcohol. So you're growing up as a woman. So what is happening? You're seeing these events happening since your childhood. Like your father is hitting, he's having alcohol, he's not taking the responsibility of the mother. So when you keep on seeing this stuff, you register in your head. Okay, gradually you register is what men's are not responsible, men's are dominating, men's hit their wife, they don't take the responsibility. So first thing what happens is you register, and how it registers, it's explained beautifully in modern sciences. You have your salka and gyra in your brain. So how the information is stored there is in form of codes. So whatever you have an idea, like see, you code a situation, a thing in your life, like fine. If a man is being example, men's are very good. I love men's, not in a bad way, but I really respect men's a lot. I'm just giving an example. So we register it in a way, we code it. How it gets coded, whenever you get an information, it goes to the sulci of your brain. There in the neurons, the information is coded in a form that it forms a network of neurons. These network of neurons are nothing but the codes which is there in your cerebral cortex. So what happens anytime when you see this thing happening, one thing is you make it, it's a very normal thing. So that's fine. Men's are like this, or they hit, it's okay to have alcohol. So eventually you see, people say, yeah, it's okay, na, alcohol he pita, he just have an alcohol, that's normal. Or he doesn't take a responsibility. Okay, we can take a responsibility. It gets coded in your brain. Second thing, what it happens is, you develop a reaction to it. So if it is a ignatia, she will develop a reaction as by becoming very ambitious. She wants to become very independent. This is her response. Ignatia responds in a way when she sees her parents fighting since her childhood. What response she gets it? I have to grow up. I have to become very independent. I have to save my mother. Most importantly, I have to save all other women. So she goes into NGOs, she goes into women liberation thing, and this is what she stores and recalls her information. Okay. For example, Pulsarilla, what she will do? She will go in that situation. She will keep on complaining everyone. Oh, see, no, my husband is doing like this. My boyfriend is doing like this. What to do? He's not listening to me. She will have an attitude of complaining rather than coming out of the situation. This will be the response or reaction of Pulsarilla. And then if someone says, it's okay, it is okay, he does. Okay, fine. You understood now. You gave me consolation. I'm fine. Okay, if it is a lac caninum patient, what that woman will do as she grows up, she will seek love everywhere. Because what is lac? Lac wants love. Lac wants to be puppied. Lac wants that affection. Because lac people are very, very, very loyal people. Right? But what happened eventually in the subconscious mind is the lac personality or the lac patient, they become inferiority complex. They go into self-depreciation. They go into a state of guilt. Fine. So let's go ahead. Sorry. As long you're with me, thing is fine?
It's okay.
Yeah.
Okay.
Fine. 1 second. Yeah. 1 second. Huh? Okay. So what is the agenda? Like, why we have to learn to understand the mind? Because that's one of the most important part of our case taking. What is the agenda? Why we have to understand that thing in homeopathy is, understanding the mind in homeopathy is important because we understand how to map the mental symptoms. I'll tell you one thing. When I was till 4th year or in my internship, we learned Pulsatilla Rota Hai. She is a weeping remedy. We know Ignatia is very, she has a changeable mood. Nakswamika, angry, irritable. This was in my thought. So when I came into internship, then I joined my mentor, and then I started reading books, and started getting understanding that no, case taking is not about, or giving the prescription, forming the totality is not about weeping. Every weeper is not pulsatilla. If you go into the materia medica, you search the rubric weeping, Viola orodata is 4 times more weeper than pulsatilla. Ignatia, she also weeps. But how she weeps, when Ignatia will start weeping, no one can stop her from crying. That is the weep of Ignatia. If Natramuse starts weeping, she will first not weep. When she is weeping, her tears will come till the eye, but it will not drop. Why? Because it is Natrum muraticum. For her, her emotions, her personal life, her private life is very important. Fine? But once Natramuse will start crying, you will see tsunami of weep. I always tell my students one thing. Sea, when you go to the sea, Natramure is, from where do we get Natramure? We get Natramure from the sea, right? How you see sea as sea shant hota hai. It's calm. It is so, it is so soothing. So it feels like when you sit with a Natramure, you put whatever into the sea, it will take into itself. Correct? When you go deep into the sea, you will get a lot of jewels into the sea. So also is the emotional aspect of Natramure. But once Natramure is disturbed, or the sea is disturbed, or there is a friction in the tectonic plates, we get tsunami. No one can stop for it. So this will be the weeping of Natramure. You can't stop her once she starts weeping. But when she is weeping, she will not utter a single word why she is weeping. When you will go and try to console her, oh Natramure, keep quiet, her body language will be in a way, do not disturb me, let me weep, let me be what I am. But I don't want your disturbance. If you go near to Pulsatilla when she's weeping, what Pulsatilla will do, she'll go more closer to you. Why? Because she wants consolation, she wants to be magnetized. So this is what you have to understand whenever you're treating a case. We should not get stuck up on just weeping, or the patient is irritable like Natramure. You have to connect all the dots. Prime thing is you have to learn what is case taking. You have to understand the depth of a case taking, right? For that, you have to understand what are the layers of mind. It's a very deep thing. We can't talk about it right now, but we'll talk about it someday. So, what are the layers of mind? So since ages, like I would say, is since many years, our culture has been studying about the mind. Socrates, Aristotle is studying about mind. Vedas, Vedantas, Puranas, everything study about mind. Now, as the modern science, it also has a study of mind. So, what's the study of mind about modern science? Let us talk about Sigmund Freud. You all have heard his name, right? So, Sigmund Freud says that the major three layers of mind is the subconscious mind, the conscious mind. Sorry, the first is the conscious mind, the subconscious mind, and the unconscious mind. These are the three layers of mind. So what do you call is as conscious mind, what do you call as subconscious mind, and what do you call as unconscious mind? Not going very deep because it's a very deep topic, but see, I'll tell you one thing. So I see a lot of patients who are autistic. I treat a lot of patients who are in cancer or very deep pathology. And I have very good results. The children have started talking. They are into much normalcy now. With the patient responding very well with the medicine. But as I grew, I always had a question in my mind. Why some homeopathic doctors, or when I was a beginner, I could treat cold and cough, or I could control pains, but why I couldn't reverse the pathology? Then I started learning the literature, understanding the literature, and then I came to know what differs. What is the difference between a normal homeopathic doctor and a master prescriber is the depth of understanding of the case. The better you understand the case, the better you can reverse. So bryonia will affect a lady, or it will give results in joint pains, but it will not reverse the pathology. It will not reverse the degeneration of the cartilage when it is given only at the particular slip. But when you understand the bryonia as a remedy at the subconscious level, then the bryonia can reverse the pathology. For example, if you're just giving bryonia because the patient has pain in joints, it is aggravated by motion, better by rest, better by heart pressure. That's it. We give in repetition, and what we see, he's better. But see, when you give remedy only at the particular level and not at the depth, you will not see miracles happening. Today in my clinic, I can see the degeneration of arthritis reversing from 4 degree to 1 degree. Rheumatoid arthritis is reversing. So your aim as a homeopathic doctor, or my aim as a homeopathic doctor, should not be just to control the symptoms. It should be something beyond that. Because see, what difference does an allopathic doctor make in a person's life if I'm giving the same results? I'm not here, or you're not here to just control the pains. You're here to reverse the pathology. You're a holistic doctor. So what defines that is how deep is your case taking. Got? So how deep is the case taking? When you understand the conscious mind, when you go deep, you probe into the subconscious mind. And if you understand the unconscious mind, that's the best thing, which is very difficult. Even nature doesn't want you to know the unconscious mind. But still, if you go to the subconscious, like for example, what's the subconscious mind? I'll give an example. Shall I had a patient. He had pain in joints. Okay. He's a very hardworking patient. Okay, I think you should guess the remedy, put it in the chat box. I'll enjoy it. He has pain in joints. He's a very hardworking patient. And he's saying, Doctor, I'm so much into my business. I'm so much into my business that even when I'm sleeping, my mind is working and thinking about my business. When I come back home, the whole night I keep on checking the webcam, whether my workers are working or not, or they're just sitting. And till today, he always says in this way, Doctor, my life is, from home to Sativili, Sativili's office. I never know anything beyond Sativili. I don't know anything beyond home. I've just worked very hard all my life. Because in the past, his father had a very big financial loss. And then it came into his mind that, no, I have to work so hard to get money. I have to be very hardworking. He couldn't sleep day and night. And today, that man has more than 50 CRs, more than 50 crores. Still, he feels he has to do more. He has to keep more stuff for him. He came with very severe arthritis. Very severe arthritis. Okay? So what could be the remedy? If you go deep to the case, what could be the remedy? Who will tell me? Any bryonia. Ridhima is telling bryonia. So this is very interesting now. See, again, I'm telling pain in joints here. The patient has pain in joints. One. Second is the patient has he's aggravated by motion, better by rest. And this is all happening in his life. I'm just giving a gist of the patient case. Anyone else? There's a lot of burning, stitching, stinging pain. So the remedy I gave was Formica rufa. Formica rufa. This medicine is made from the ant. The ant, right? That's the remedy I gave him. So now here, if you're understanding the patient at the subconscious level, what we did was, okay, I would have also done the same when I was in the beginning of my practice, or I was not exploring this part of case taking. Got it? So what this happened is, here we thought at a very superficial level, okay, he has manika insecurity, right? He is having, he has seen a lot of poverty in his life. He has joined company, we gave bryonia. Why not Formica rufa? Why we couldn't understand? He's so specific that, see, doctor, my life is between my home and Saturday. How is an ant? Ant never goes beyond her mark, na? From where she takes the food until the ant house. They will never go beyond that. They're very hardworking. They have a lot of stuff stored. Still, they want to just stuff. Still, they want to keep a lot of stuff with them. That's Formica rufa. The difference between bryonia and Formica rufa is great. So we have to understand what is a subconscious materia medica. Yeah, bryonia is also occupied with business worries. But see, again, if you go deeper, you will understand what is the difference between Formica rufa and bryonia. When you take a deeper case, we skip that remedy. Okay? So going ahead, that's when we understand the subconscious mind of the patient, we are able to treat this kind of. Now, what is conscious mind? What is subconscious mind? So conscious mind is that part of your mind which is in your control. For example, now we all are listening to a lecture, correct? Or whenever we are sitting in a class and we are listening to a lecture. So we all want to sleep in the class, when we were in college, whenever there's a boring lecture, we just want to sleep. This is what many times we like to do, or we just want to go out of the class and have water, go into the canteen, have something, or when urged to urination, we just don't get up and go to the bathroom. Why? Because of the conscious mind. Our conscious mind is about a filter. What does the conscious mind do? What it does is, it is in your control. It knows I don't have to do this, I have to do that. Correct? And now the deeper part is the subconscious mind, which we are not aware of. Most importantly, things which we are not aware of may be things which has happened since our childhood, and we have developed in a particular way or a particular pattern, and this is how we react or respond to the situation is subconscious mind. So whenever you're taking a case and you're trying to get into the subconscious mind, or whenever you're reading materia medica, you tried materia medica at the level of subconscious mind, this is where you will differentiate yourself with a master prescribe. The subconscious mind is about memory stored. And unconscious mind is what? Even your inner self doesn't know what it is. It could be your fears, it could be unacceptable desire. There's no logic to it. For example, many people I have noticed, they have extreme fear of lizard. They just see the lizard, they jump. There's no history of any fear of the lizard. From where does this fear has come? Right? Sometimes a person is in a very good mood, is in a normal condition, normal situation, but so unconsciously, whenever he's getting angry, he just have an urge to kill someone, or he feels I'm in a battlefield, everyone is my enemy, and I have to protect. But there's nothing such thing happen in his life. He is not a king, but these are his unconscious reactions coming out. Right? Now, these unconscious reactions are something which we are carrying from many lives, maybe, which are not surfaced in this life. And most of the time, when the patient is in acute, he's in his acute deathbed, or he is in his delirium, or you have noticed after we give anesthesia, the patient is coming out of anesthesia, he talks irrelevant things. He talks about irrelevant objects. These are nothing but his unconscious and subconscious mind speaking. Okay? For example, let's understand the childhood, right? So childhood is the foundation. It is very important part of psychological development. All your early experiences shape the mind and affect the health throughout the life. Everything in your childhood affects whatever you are today. Trust me, whatever you are, whatever your responses are shaped from your childhood. So it has been said that when a child is born, till a particular age, maybe till he is 13, 11, 12, his emotional part of the brain is developing. So at that time, till 0 till 12, you have to give a lot of emotional support to the child. You have to be very emotional. So the child, till the age of 10, 11, he needs his mother. Why? Mother is a symbol of nurturing. Mother is a symbol of care. Mother is a symbol of affection. While mother is yin, it's a feminine part. Feminine is all about emotions. Okay? Male is masculine part. Yang, it's all about intellect. It's all about logic. Correct? So the child till the age of 0, till the age of maybe I would say 12, he needs mother. Why? Because here his logical brain or intellectual part of the brain or the cognitive brain has not started to develop. So every year you will see, at the age of 2, you will see child needs a lot of trust from his mother. So the child will always see whether her mother is leaving him or not, she's there or not. Correct? As the child grows, you will see suddenly the child is becoming very obstinate. Why? Because now at the level of emotion, his obstination is coming out. Gradually, when the child is 13, that time he starts arguing. His argument has a logic because here the cognitive part of the brain starts. And from that part, actually it is the role of father which takes into place. Why? Because father is about logic, father is about discipline, father is about masculine part. So then fourth, the logical part of the brain develops. So if you give proper emotional field to your child from the age of 0 to 12, you have an excellent human being growing up. And if you give proper intellectual, logical feed to a child from 13 years old till 19, you have an excellent logical child growing up. So once a child or once a patient is 15, if your child says, I want this, you have to give him logical explanation why you should not be having this. And he will accept it. But if you try to explain logic to a 5, 6, 7 years of child, he will not. You have to emotionally mold the child. So homeopathy treats the individual history not just on the basis of current complaints. So his emotional traumas, how was his parenting, these all play a very, very major role in our case study. Okay? Everyone is with me? Am I able to, hello? Dr. Manish?
Yes,
Yes.
audible, please.
Hello, Dr. Danesh. How are you?
Yes, please continue, doctor.
Yeah, because there's no screen now, so I'm
Yes,
not
yes.
sure if everyone is able to get with me.
So without screen, you can convey, no problem. Nicely conveying, no problem.
Yeah. Thank you so much. So I'll talk about some very interesting rubrics about childhood. Fine. So as I said you that childhood or children, they absorb emotional atmosphere very, very deep. Correct? Like for example, you will see that when there's some any trauma or anything in childhood, the child as he's growing or adult he's growing will show a lot of night terrors. There are a lot of separation anxiety. Matlab, see, you have seen now a lot of times when there's a breakup between a teenage child, one of them cannot tolerate the separation. They may even go to suicide or they may go into depression. Why? Because maybe when the child was growing up, during that period, he was seeing a lot of fights between the parents. And he couldn't resolve that conflict which was going on, right? And because of that, what has happened was the child has got this separation anxiety. For example, asthma, which is triggered through emotions. Correct? One second. Just give me a minute. Huh? Yeah. So I'll give you some examples from Materia Medica. Like for example, when a child, I've seen a lot of children in their childhood, when they have seen a lot of fights from in like the father is very dominating or mother is very dominating, and these children are highly excitable, they are full of life, very beautiful, very cute children, or a very beautiful adult she has grown up into. But she has a history of fright. Think of remedy carcinosis. If the child is sexually abused in the childhood, okay? If the child is sexually abusing of the remedy carcinosin, plumbum metallicum, platina, this is the reason why platina don't like men's because she has a history of being sexually abused. Remedy like arnica. So that I remember a patient of mine, I was treating a lot of orphanage children. So one of the orphan girl, she had history of rape in her childhood. And then she grew up, she got married. So she was not ready to have physical relationship with her husband for 3 years because she said, I feel I cannot bear the pain. So that trauma was not physical, that was a mental trauma. So remedy I gave her was arnica. Okay? Again, when there is death of loved ones in the childhood and that person is very close, and since then the person when he has grown up has a lot of, he's still carrying the traumas of the childhood. Think of remedy aconite, arsenic, opium, phosphoric acid, lachesis. Phosphoric acid is such a beautiful remedy. In the childhood, they are very understanding children. I remember a case of phosphoric acid. So this boy, he came to me, he was 19 years old. He was into anxiety. Okay. So I took his complete history. The mother said, Kia, he's a very understanding child since childhood. Remember, if the child is very understanding, na bahut bada gadbad hai. The child should not be understanding. He has to have tantrums sometimes. He has to express his emotions. So what had happened? She said, Doctor, she is such an understanding child, I'll tell you. My first child was a mentally and physically challenged child. He was completely on bed. Okay. And when that child was born, after 2 years, this boy was born. And I don't know from where he got such a maturity. He never demanded anything from me. He never asked anything from me. In fact, he always left me with him. He was so much okay with it. And I was looking at the child's expression. His expressions were frozen. Though he was in state of anxiety, but I could see a frozenness in his expression. Okay. And then what his frozen expression shows is there's some silent grief which he cannot express, which he wants to express, but he cannot express because he knows there's no one to understand. So he tried to digest the grief himself. But eventually what has happened is, in that process, he became frozen. So silent grief, which he couldn't express. So right now, his acute totality or whatever anxiety symptoms he was getting was going towards aconite. But understanding his whole history, I gave him phosphoric acid. Because of the frozenness, silent grief from the childhood, so much maturity, so much precocity. He was so much for the mother and the elder brother that he forget himself. This is phosphoric acid child. Okay? Now, when the child says there's a lot of domination since childhood, the child says, doctor, my parents were very dominating since childhood. And because of that domination, this is what I am. I'll tell you a case of mine again. This is a case of schizophrenia. So this patient who came to me, he came when he was 25 years old, adult. So I said, how it happened? He said, doctor, I don't know something. I was a very hardworking child and I always scored 80%, 90% in my school and college. So when I went to 12th, I got distracted in a friend circle. But my father was very strict. He was a military man. And he said, you have to study science. I'm an art child. I wanted to become an artist. But he's like, you have to you have to go into science. You have to take engineering. And he was very dominating. And they have high expectations from me. Even my mother, she also gave me a lot of pressure. I couldn't tell anyone. So I've always lived with a conflict in my entire 12th. And suddenly, I could see news coming that his name was Ram. Okay, Ram. So he said Ram is a suicide bomber. Ram is caught by police. I could see these news coming in the newspaper. I got scared, right? So that remedy I gave was anacardium. Why? Because lot of harsh upbringing since childhood, lot of domination, lot of pressure from the parents, which led into a conflict. Now here, because of the conflict, he became very violent. He wants to hit and kick, but he controls his anger. So remedy was anacardium. But see, you cannot give anacardium to everyone who is into a state of conflict, correct? Or who is into schizophrenia. You have to understand what, and this you get through a proper case taking. Another example I would like to quote is about ailments from lack of warmth and security at home. The remedy is laccan. So laccan child will say, doctor, since my childhood, my mother was working, my father was working. I was just sitting and waiting when my mother will come, when my father will come, they will hug me, they will care me, they will give me a chocolate. But they were so busy in their life, I couldn't get that love and warmth and security. They gave me best of education, they gave me everything. But I wanted warmth, no? I wanted that when they come, they should hug me. But since then, I started feeling it's my fault. Maybe I'm not good enough. I'm not a good child. Because they are very good with my cousins, but they are not good with me. They don't want they are not giving what I want. So he's gradually developed, and the remedy given was laccan. Okay. Now, and again, very interesting rubric is when the child gets vomiting. Remember, this is a this rubric, what I'm telling you, or this symptom is so confirmed symptom is when the child is having vomiting and the mother has history of anger, like she's feeding the child and she's getting angry and shouting at the maid or the husband or the mother-in-law. Think of the remedy valeriana. The child's vomiting will not stop. So just see for vexation in the mother when she is feeding the milk. Ailments from punishment, you have remedy like natrum, carcinosin. Ailments from emotional excitement. Children are, so much emotional excitement. And then the pathology comes is Manzanilla. So childhood traumas, as I said. And see, today in this lecture, I'm just talking about the child case, case taking of a child, how to unlayer the mind of a child. We just have, I think, 5 minutes left, Dr. Danish. So childhood traumas and their impact is very, very high. I think we have just 5 minutes left now. I'll just wind up fast.
Yes, I think you can take another 5 minutes, then we can have a discussion for 2 minutes.
Yeah, fine. I'll just wind it up in short. Okay. So how do you understand a lot of psychological development is you can go through Freud's psychosocial, psychosexual stages, understanding the Erickson's 8 psychological stages of development. There are so many things which can help you. But remember one thing, till you don't get the correct symptom, you will not able to do miracle in homeopathy. What Ken did, what Farrington did, etc. Right? So, like for example, we gave a lot of remedy ka example. When there's a history of abandonment and grief in the childhood, the person, even when he grows up, he always feels VP, he avoids confrontation, like magnesium, natrum, pulsatilla, ethuja. You know, ethuja is such a beautiful remedy. I would say it is one of the most introverted remedy in a materia medica. Ethuja child is such an introvert emotionally that he is not interested in humans much. He is interested in animals, because the thinking of Ethuja is humans hurt, but animals don't hurt. So they are the people who go into serving animals, taking care of animals, talking to animals. This is the remedy Ethuja. When there's history of abuse, history of loss of support, remedy is stramonium. Stramonium is a remedy which is triggered after the person loses support. When there's fear of failure, you have remedies like lycopodium, silica, anacardium. When the child is neglected from the childhood, or he is feel ridiculed, like you're not good enough, you have to do much more. Remedy is sacrum officinalis. Remedy is chocolate. Remedy is magnesium mure. Okay? So, so the most important part whenever you're taking case taking is you have to understand not only the patient, but you will have to understand the deep-seated pathology of the case. Why this happened, what is the reaction, and there are so many questions you have to ask. You cannot just get the symptoms. You have to go deeper, deeper, deeper. Along with that, you have to understand the childhood impressions, what are the developmental changes which has happened, what is the coping mechanism of the child, because every remedy has a different coping mechanism. And that coping mechanism is again directing us towards natrum. For example, natrum coping mechanism is emotionally safe activities like dancing, reading, painting, etc. Correct? And so I just want to give some tips to the parents or the practitioners, small tips. Whenever you have a patient, most important is stay very observant with the patient. Just observe, just don't sit and write. Observe the patient, observe his every movement, observe his eye movements, his hand movements, when he's giving a case, which part of the body he's touching, because he's communicating with you. Use open-end questions, don't use closed-end questions. Don't be judgmental. Even if the patient will come and say anything stupid, you have to be very unprejudiced and non-judgmental. You have to know why he did this. Always respect the patient's peace. Okay? And to conclude with, psychological layers help trace the root of the disease. Mapping helps to connect emotions to the remedy. Key to deep and lasting cure is you have to have a very detailed case taking. And this is what we have just put it on the screen, friends and doctors. So, Dr. Danish, so this is about my webinar where I'm going to teach each and every part about case taking. You can just note my mobile number or email ID, everything like how to take a case in a psychiatric case. You can't take a normal case in a psychiatric case. You cannot take the same symptoms. How to take a case when you go to the bedside when patient is in ventilation, right? What to see in the patient when he is in ventilation or he is in sepsis, correct? Or how to take a pediatric case taking after taking all this kind of different kind of cases, how to choose which is the right symptom for the case. That's another thing which is very important. We have to learn. And third most important is to convert into rubrical language, how to differentiate. This is all I'm going to talk or teach in my webinar series, which will be there for 8 sessions. So everyone is invited to join in. If you have any queries, you can mail it to me or message at my number, which is there on the screen. And with this, I would like to end my today's webinar. I'm open to all the questions, whatever you have, whatever questions I can answer, I'll try to answer.
Okay, thank you. It's time for discussion. Those who would like to participate, please raise your hand. In fact, it's a nice presentation. A lot of essential elements were beautifully blended in this presentation. As as I rightly mentioned, the psychological mapping in homeopathy case taking. That is all. It is homeopathy. Without the psychological or the connections to the emotional symptoms, homeopathy will not work. Moreover, in almost all diseases, as rightly mentioned by Dr. Samuel Hahnemann, why you are giving so much importance to these mental symptoms? Because each and every medicine has got its own ability to produce the emotional disturbances in patients, especially when giving in potencies. That's the most important thing. Then you mentioned about the vexation mother causing vomiting. Well, these are all totally practical subject. Totally practical, no much theoretical explanations, but in fact, the ordinary man is always suffering. So the homeopathy, it gives a solace to all kind of problems of human beings. So now it's up to the common man to identify this is the in fact God's own gift. As I mentioned. Yeah,
Exactly.
we all know that. We all know that the suffering of the emotional suffering of the mother, if you cannot feed the child, always omit. At the same time, mother is suffering a lot of tensions also. What is the long solution? Only homeopathy. The others will give a lot of counseling, so many advices, but that will not work. What is the care? So time for discussion. Sir, Pram Parveshra, sir is ready to discuss something. Yes, sir, please. Yeah.
Thank you, Dr. Manoj ji. Everyone, namaskar and congratulations, Dr. Shelly Sharma.
Thank you, sir.
Very, very thanks, Dr. Shelly Sharma ji. Grateful for your kind support and guidance on this mind rubric and mind symptom and collect the totality of symptoms. There are two ways. First, objective symptom. Second, first subjective symptom. Second, objective symptom. Subjective symptom is a very important symptom on talk the patient, and objective symptom. And other past history, family history, whether is the very important role of homeopathic select remedy. The main cause of disease, according to homeopathic, mind. Without mind, not cure the patient. Mind is the very important, according to homeopathic science. बीमारी का कारण ही माइंड है. कहा भी गया हमारे शास्त्र में हिंदी में कि सुनहु तातव मानस रोगा, जिनते दुख पावहि सब लोग. ये भाई मन का रोग सुनिए, जिससे सब लोग दुख पाते हैं. मोह सकल व्याधिन कर मूला, तिनते पुनि उपजहि बहुत तूला. बीमारी के कारण मोह ही है. अमृत भी क्यों नहीं हो. ज्यादा दूध पीजिएगा तो पेट खराब होगा, ज्यादा झूठ बोलिएगा, ज्यादा दिलियस माइंड रखिएगा, फर्टिलिटी ड्रेन होगा, लास्ट में ट्यूबरकुलोसिस का बैक्टीरिया ग्रोथ करेगा. तो माइंड सिम्टम इज अ वेरी इंपॉर्टेंट. एंड अदर एक एक बीमारी माइंड से है तो हिंदी में हम बोल रहे हैं, काम बात कफ लोभ पारा, क्रोध पित्त नित छाती जारा, तीनों भाई करही प्रीति, उपजही सनपात दुखदाई। एक्सेस ऑफ सेक्स, आने वाला समय में उसके बाल बच्चा या जो भी हो उसका खुद जो है बात का शिकार होगा, जो हमारा साइकोटिक मियाज में आता है। और ज्यादा लोभी प्रवृत्ति वाला व्यक्ति को कफ का फॉर्मेशन होता है, ज्यादा क्रोधित प्रवृत्ति वाला व्यक्ति को गैस का फॉर्मेशन होता है, डाइजेशन ठीक से नहीं होता है, गैस बनता है। तो बहुत सा ऐसे लिखे हुए हैं कि माइंड इज अ वेरी इंपॉर्टेंट, माइंड से ही बीमारी का जो है इजाद हुआ है। तो एक दिया है बहुत डायनेमिक, परसुख देखी जर्नी सोचे, कुष्ठ दुष्टा मन कटुलाई, अहंकार अति दुख डबरुआ, मद कपट बदमान नेहरुआ। दूसरे को सुख को देखकर हृदय में जेलेसी दाही प्रवृत्ति रखता है, उसकी वाइटलिटी डिरेंज होता है और ट्यूबरकुलोसिस का बैक्टीरिया ग्रोथ कर जाता
Sir,
है।
please speak in English, sir.
Huh?
Please speak in English, sir. There are people
इंग्लिश
who
माइंड पर बोल रहे हैं हम। एक शास्त्र का चीज था, एक रामायण से आता, तो इज टॉक माइंड इज अ वेरी इंपॉर्टेंट, माइंड इज अ वेरी इंपॉर्टेंट जो है इन द होम्योपैथिक साइंस। विदाउट माइंड नॉट क्योर द डिजीज। एंड फंडामेंटल लॉ ऑफ होम्योपैथिक 3, सोरा, साइकोटिक एंड सिप्लिटिक। सोरा ही बीमारी का माँ है, सोरा इज द मदर ऑफ ऑल डिजीजेस।
Yes.
थिंकिंग ही सोरा है। तो वेरी वेरी थैंक्स डॉक्टर शैली शर्मा जी, थैंक यू।
Yes. Okay. Anyway, your presentation remembers us the former Prime Minister Atal Bihari Vajpayee. Your motions, the sound modulation looks like that. Okay, thank you for that. Anyway, one thing we must remember that the sensitization of mind is often happens as a result of this aura. As rightly mentioned by Hanuman, yes, thousandfold vexations are there in his life. But what was not affected by all these things because he was not so rich. So the beyond that, the miasm is there. Without the miasm, he will not affected. Anyway, time for to conclude the session. May I invite Dhanesh to express sort of thanks to Dhanesh.
Thank you, Dr. Shelly Sharma, for coming over here and making such a beautiful case, beautiful presentation on case taking. And you really deserve kudos from all the participants here, because you are such a nice person who know immensely about the mind, the aspect of mind, how it affects the patient, and how one can choose the remedy according to the mind symptom. As rightly as Dr. Rampareshwar sir point out, the mind is the thing that really individualize a patient from other patient. And if you are able to understand what is the main reason for the illness, you can find the cause behind the illness in the mind. And if you get the right symptoms from the mind, the right reason for the disease, definitely you will be a winner with the homeopathy. So congratulations, Dr. Shelly Sharma, and we are very happy to know that you are doing a wonderful job for promoting homeopathy among students as well as junior doctors, as well as those who want to join in the from the senior side also for this webinar session you are conducting on case taking. So we are all with you. We support you, and thank you for coming over here and make such a beautiful presentation once again. Thank you, Dr.
Yes.
Thank you, thank you.
Okay. One thing most remarkable is mentioned about this intellectual and the logical component acting only after around 12 or 13. That's often the vexing problems of parents, and they should understand that. The remark will be conclude today's English edition. Hope you will be back again tomorrow. Till then, goodbye. Time for Malayalam session. Thank you.
Okay.